Hi, and welcome to our upper body lymphatic massage video. In this video, we're going to learn an upper body lymphatic massage sequence to help you maintain your health in between massage therapy appointments. The lymphatic system runs throughout your whole body, and it's a pressure gradient system designed to move fluid. Sometimes it can be compromised though, and in those times, we can utilize lymphatic stimulation through manual contact and through movement to help move fluid. This sequence can be done laying down or sitting up, in case you can't lay in a certain position. We're going to start today by learning to breathe. Because the main pump for the lymphatic system lies in the abdomen along the spine, deep breathing can help start the pump. We want to make sure we're breathing out this way, and out from the back as well. If you're unfamiliar with deep breathing, that's okay. We're going to learn now. So, the first thing you're going to do is I want you to place your hands on your abdomen, and you're going to take deep belly breaths. We want the belly to move rather than the chest because we're looking to compress the lymphatic channels in the abdominal cavity, okay? So it looks like this. Do you see how my hands move? Next, we're going to practice moving the rib cage in and out. Place your hands along the side of your body so that you can feel whether or not your ribs are expanding. Now, we're going to keep this, and we're also going to try to move through here. Watch. Good. Did you get that? Next, you're going to move your hands to the back of the body to see if you're breathing through the back. Keep all the other elements too. Ready? Here we go. Breathing can actually be a very hard skill to master, so don't be surprised if you struggle with this at first. One little helper hint is if you're having trouble doing it sitting up, you can lie on your back, and when you're not having to create postural tension, it's easier to breathe. So we're going to utilize that breathing for 3 to 5 minutes in the beginning of our lymphatic sequence. So before we do any of the touch or hands-on, we're going to breathe for 3 to 5 minutes. Now I'll show you the hands-on. The hands-on part of lymphatic massage focuses on putting pressure on the lymph nodes to stimulate them through pumping action and gentle touch of the skin. We're going to start in that area right up front here where I told you those lymph nodes are. So we're going to do that deep belly breathing that I showed you, but this time we're going to put a little bit of pressure right under here where the ribs meet. It's very gentle pressure. You shouldn't feel your heartbeat. It's just enough to slightly compress the area. And then we're going to do 1 minute of belly breathing. Great. Then we're going to move to the next proximal, meaning closest nodes. And those nodes are right here in the inguinal area. So I'm going to apply gentle pressure towards the center of the body in a wave-like motion like this onto those nodes. Okay? Watch. 10 pulses. And then I'm going to move to the other side. Then we're going to move on to the upper body, since we did the central part, and we're going to focus on the neck and the axilla area. All of these help get the lymph moving, and then we'll look at the skin contact. So first we're going to find your collarbones right here. You're going to put your fingers gently at the collarbone. I'm going to move my necklace there. If you have one, do the same for yourself. And then moving gently with very light pressure towards the center of the neck. Ten times. And then we're going to pump the nose on the side of the neck. The motion is forward towards the front of your body. Ten times. And then we're going to move to the axilla, which is the area here, their nose there, and you're going to gently cup the axilla and you're going to pump. The pressure is very gentle. Think about gentle, liquid movements as if you were swimming. And then the other arm. Good. And then we're going to do the elbows. Good. Now we're going to start to move fluid. Take the hand, place it gently on the skin, and you're going to slightly pull the skin towards your body and release. Pull and release. Pull and release. Move the hand up the body. Pull and release. Pull and release. Pull and release. Very slow. 5 times in each area. Now, I'm exaggerating the movements a little bit so you can see clearly on the camera, but it is very subtle. Up into the shoulder. And then we can do the inside of the arm. And across the chest. And then we would repeat on this side. Once we've done the skin stimulation on both sides, we're going to work our way backwards through the nose. So now we're going to pump again the elbow 10 times. And then the axilla 10 times. Elbow, axilla, neck, ten times, and then back to the center, where we're going to do some resisted breathing. for 1 minute, and then go back to your deep diaphragmatic breathing for 3 to 5 minutes. That ends our sequence today. You can also use movement to help move fluid if you're more comfortable doing that. For that, we recommend elevating the limbs that you're having issues with and gently moving them. 5 to 10 times to activate the muscle pumping. Like this. And you're going to combine that with that deep diaphragmatic breathing that we showed in the earlier section of the video. It looks something like that. Stay tuned for our next home care video.